And now we move on to the final speaker. We're moving down to the micro level, where we will hear from Good Food Oxfordshire, another living lab, feast living lab based in the UK. And to present will be Caroline Welch, project lead at Good Food Oxfordshire, with the presentation called Shaped by Community Voices, Rethinking Access to Healthy and Sustainable Food, where Caroline will share lessons from their community approach to improve food access, affordability, and healthy eating. Caroline, welcome. The floor is yours.
So thank you for that introduction, and thank you to the previous speakers as well. I think my presentation will follow on really nicely, and actually I was just reflecting on the engaging with older adults, and that will come through a little bit in our presentation as well. So it's good to have that that common theme as well. So thank you firstly for giving me the opportunity to speak today. I'm going to be sharing our experience of working as the Oxfordshire Living Lab for the Feast project. So we really sort of look to collaborate with local community groups to help to co-design solutions for their healthier and more sustainable food. And we were looking to work with people who were particularly at risk of food insecurity and diet-related ill health. So this presentation is not going to be a presentation about a perfect project in any shape or form. It's a presentation about what happens when you set really good intentions. You start off with great, robust methodologies, but when those come together with lived reality. So really what I want to bring out is what we learned by being willing to adapt through that process, and also how it shaped our work going forward, or how it will shape our work going forward. But firstly, an introduction to Good Food Oxfordshire. So Good Food Oxfordshire is a food partnership based in the UK, in the south of the UK, for those who aren't based here. So we work as a critical, but we believe well-established connector within the county's food system. So we're looking to bring together a really wide range of stakeholders to provide valuable insights, and those stakeholders help with those insights to help influence policies for that healthier and more sustainable and equitable food future across Oxfordshire. And we think that the strength of our network that we support is its diverse membership, but also its real sort of collaboration to action. And we have a shared goal, and that's from our farmers, from the fork to the plate, from the researchers to the community groups that we support. Everybody who's involved in our network has a shared goal, which is really simple, and that's to ensure that Oxfordshire has the food that they need to thrive. If you know Oxfordshire or Oxford, you might associate us with being a well-heeled university town, affluent and prosperous as well. We're actually quite a rural county, but in Oxfordshire we see a really stark picture, which I think is quite familiar across the whole of the UK and probably across the whole of the EU as well. So we see rising food insecurity, we see widening health inequalities, and we see an increased pressure on our community organisations. So a real reliance on those sort of volunteer community organisations that work in our community directly. But at the same time, as experts working in this area, we know that diet-related ill health isn't driven by a lack of poor motivation, or is it shaped by poor choices. It's an issue of cost, access, time, confidence, culture, and environment. So that's why from the outset, when we were working with Feast, we were clear that we wanted solutions that weren't designed for communities, but instead that we needed solutions that would be designed with them. And we wanted these solutions to be really grounded in people's lived experiences. So now to move on to what I'm going to talk about today. So very simply, I'm going to take you through 4 things. Firstly, what we plan to do through the Oxfordshire Living Lab, what changed when we started to work with these real communities in practice, what emerged from that work, and I've got a couple of short case studies, and then finally how the experience has shaped the work that we do now, and really what you might take from it as other people working to influence this sort of change in your environment. So what we planned. We set off with a wonderfully robust methodology, as I think lots of these projects do. The Living Lab structure we're really excited about because it gave us a really nice structured but flexible framework. So at its core, the Living Lab structure gives us the ability to think about working with real places, real people, and on real problems, and by learning as we do it along the way. So crucially, it treated lived experience as a form of expertise. So recognizing that expertise is often seen as sort of academic and professional knowledge, but recognizing that lived experience is just as valuable through the process. So this is my very simple picture of our planned approach. So we really wanted to go in initially to sort of look at and understand the barriers with the different community groups. And we thought once we understood the barriers, we could work with these community groups and co-design solutions with them. And then once we co-design solutions, we thought we would test and learn to build on that and to reflect on what worked and what didn't work and why. So we really did design this to be a very sort of rigorous, but at the same time, participatory process. And this is the part where we thought big. So because our food network covers anybody that lives, works, or even travels to Oxfordshire, we have a breadth of people that we work with day to day, our group support, and that we work with. So originally, when I first came into the project, there was a plan to work across the range of groups, any groups that had a higher risk of food insecurity in the county. So that might be families, old adults, it may be ethnic minority communities, anyone that we could work with through our trusted grassroots organisations across Oxfordshire. And that breadth really mattered to us. But in reality, that changed very quickly. It became clear that that was maybe too expansive a starting point. So I'm going to get into the nitty gritty now. So how we went from our nice robust plan, which obviously had a lot more rigor behind it than perhaps I've presented today, but I'm sure you can imagine the ethics applications and the different questionnaires that we created, etc., in planning this project. But moving on now to actually the challenges that we found once we got started. So as I've possibly alluded to already, one of the first adaptations we had to make was around the scope. So coming in and reflecting on the wide range of people that we thought we could interact with, whether it's age group or socioeconomic group or rural or urban, we recognised that actually with our local knowledge and with the data that drives lots of the work that we do, that really we needed to make this project as successful as possible, we needed to focus our areas and our priority groups. Through a range of discussions and analysing data available to us through different lenses, we focused our priority groups to families with young children and to old adults. And this sort of nods to the previous presentation, that we felt that the older adults were a really underrepresented group who often don't get supported with this type of intervention. And because we have a range of community groups who are part of our network, they seem to be suggesting that we had community groups that supported both of our target demographics who were really keen to engage with us. But the reality is that many of these are actually volunteer-led and stretched in capacity. So in practice, even though we sort of narrowed it from any group that could face food insecurity in the county, and we narrowed it to these two target groups of the families with the young children and older adults, in reality, we ended up really only being able to engage community groups that supported families with young children. we just couldn't get the engagement with the older adults. It was a time and capacity thing primarily, but maybe it was a little bit of concern about whether the people that they supported, whether they would actually be interested in moving, in spending time thinking about diet. So I suppose a really key learning for us once we got going was that interest doesn't always equal capacity, especially when you're looking to work with community groups. And that's was a really interesting reflection. We also encountered a real tension between academic rigor and real life constraint. So I've already talked about the fact that we had some really good, robust baseline data, and we built our methodology using validated dietary questionnaires. And from a research and other processes, and from a research perspective, I think that really was the right thing to do. So we started off with a great plan, and it went through ethics, and it was very well planned out. But just to take the questionnaires, the validated questionnaires as an example, in reality, for people in these community groups, these questionnaires were really long and laborious to fill in. Now, I work as a nutritionist, and quite frankly, completing it myself, I found quite tedious, even though food is my passion, nutrition is my passion. They were just, they asked lots of questions about how often you consume foods and how often you shop for them, and it felt repetitive and quite a large chunk of time to complete them. This was possibly even more so for really busy parents who are juggling childcare, work, and other pressures. And ultimately, what this meant for us, that it did actually affect participation and completion rates as well. And that was the feedback that we got from many of the groups who joined our Feast co-design process. So this really has forced us to reflect on whether our tools were proportionate, especially with fitting in with people's realities, and how we need to just take a step back, I think, and recognise that sometimes rigour can become a barrier to working with communities and to people on the ground if we're not careful. And this slide, reality 3, so this time, trust and research fatigue sort of covers a number of different factors. But I think the first and the most important is that Oxfordshire's strong community, our strong links and relationships in the county didn't stop the fact that onboarding these community groups who we work with day to day, it still took a really long time to onboard them into the process. So we spent a long time planning and preparing to engage with them and thinking that we would have them onboarded quite quickly once we had all the documentation and we could explain the project to them. But actually the reality was they had other competing priorities, or the person who they felt in their community group that could support it through wasn't available until, and then school holidays got in the way, or other competing demands really did just slow down the whole process for us in a way that I don't think we, any of us on the team expected. But there was something else that we had to really confront honestly, and this was something we confronted before we really got going with engaging community groups, is that Oxford, as I've already alluded to, is a really busy university city. It has a great strong research culture, which is really important. However, many community groups that we work with tell us in preparation for this process, but also through other work that we do, that they feel quite over-researched. The researchers come into their community group, they take up time, they take away data, they take away lived experiences and stories from people who work in those groups, and would support those groups and volunteer in those groups, but then they leave the groups, and they leave the groups without any tangible benefit to them. So there's a big investment for these groups, and then they walk away, the researchers walk away, and the groups aren't left with a huge amount, maybe an enriched conversation, but not a lot more. And naturally, this creates a real power dynamic. And we knew that this was something that we were going to have to address head on. And actually, it was something that we did plan for in the planning stages, which again, slowed the process down a little bit. But I think it was the right thing to do in the circumstance. So this is one of the key adaptations we made early in the project. So our response to this challenge of being over-researched was to create what we called a community facilitator role. So rather than it being a community researcher role, because we didn't want to claim it was something more than it was, to become a good researcher, it takes years of experience and learning to get there. So we called it a facilitator role. And the idea was that instead of external researchers, be it us at Good Food Oxfordshire or someone from Heidelberg University who are supporting us through this process, we look to train trusted members in each community group in basic research and facilitation skills. This meant that they were able to actually explain the work to the people in their community groups in a way that felt far more meaningful than we would. It meant that they could lead the conversations within their own communities, so the trust was already established. And also it meant that it reduced the sense of extraction. But importantly for us, this meant that we left something behind. So we left research skills and we left behind confidence. So that once the project was ended, there was somebody in that group who could take the skills and successfully build on that for future projects, so that they could use it to sort of show impact for future grant bids, but also just to make a sense of sort of a little bit more method and rigor to different initiatives that they wanted to plan for in the future. And this approach was hugely successful, but we also have to reflect that it did add some time and complexity to the preparation process, developing that training, but also sitting down and working through that training with community members who maybe had different learning needs. That was something that we had to sort of develop and really work on. And I think my reflection from that is, we talk about living labs being a participatory process, and that's incredibly important through that structure. But actually, to truly share power through a research process does take a lot of time, effort and energy. But I think my reflection is that it was worth the extra time to get to that point. So despite these challenges, the realities that I've talked through, or perhaps because of how we adapted, we feel that we are able to work really deeply with maybe a smaller number of groups than we originally intended to work with. But we really felt that what emerged were solutions that were practical, they were relevant to each of those groups, and they were solutions that were shaped by everyday life. So here I'm just going to share 2 examples of the groups that we worked with. So the first is a group called Sustainable Wantage. So Wantage is a small town, it's more rural, so it's a small market town. And Sustainable Wantage, I believe actually they weren't started from a food focus. They were started with helping people get solar panels, finance available for getting solar panels fitted on their homes. But over time, they developed into a much broader offering, and going back to the WRAP presentation at the start, working on sort of anti-food waste campaigns, but also they have a refill shop and various other initiatives. But they've developed into a really collaborative and vibrant community group in the local town. And the work that we did with Sustainable Wantage, or through the work that they did, because it was very much led within the community by one of their facilitators there. But we heard through those processes that families wanted practical cooking skills. They wanted those really affordable, family-friendly meals, and they wanted the ways to reduce waste as well. So that was important to people that engage with Sustainable Wantage. So together with them, the team worked to co-design community cooking workshops, as well as a locally curated family recipe book. And we also created a digital recipe hub with short videos, which actually we host on the Good Food Oxfordshire website. It's a mouthful this morning. And yes, so we have that sort of repository for other groups to draw on as well. And through that process, we saw a really sort of encouraging change. So we did see an increased consumption of fruits, vegetables, and whole grains, and significant increases in meals cooked at home. And we saw small improvements through our measurement in confidence around around food insecurity. So I think the key takeaway for us here with Sustainable Wantage was that peer-led practical support mattered to them far more than information alone. So they didn't necessarily want to have information about what is healthy food, how do you deal with food waste. They wanted far more practical interventions. So it was finding ways that we could do that in person, but also digitally to ensure the sustainability of the solutions that they created. So the second case study is with a group called Cherwell Collective. So Cherwell Collective is based in Kidlington, which is another small town, but slightly closer to Oxford City in itself. So again, you have a slightly different demographic here, maybe a more challenges with food insecurity for sure. But again, it was the families that really wanted to get involved with the Feast project. So with Cherwell Collective, time and family pressures were the ones that were front and centre. So they were the barriers that came out in that initial engagement piece. And with them, we actually looked to develop and design family cooking sessions during the summer holidays. And I talked before about how school holidays was a real barrier for us to actually get going with the community groups. But then for Cherwell Collective, it really presented an opportunity to have cooking workshops where the families could come together and cook together. And it served as a great activity to do during that long summer break, and a good opportunity for parents to connect with their children in a really practical way. So as I said, these activities really involved children directly. So it wasn't just about parents learning to cook, it was wider than that. Alongside that, we also added a communication campaign that focused on affordable, healthy food. And through these different activities, and I've got so many resources, I couldn't actually fit all of the pictures on the slide. I think I've got one more just to show some of the photos from those sessions as well. Participants told us that they felt more confident with cooking. They were then actually more willing to involve their children in the cooking process as well. And as a busy working mum, I always remember that balance between wanting the kids to be involved and actually finding it far easier just to do it myself. So that little, that little bit of friction sometimes is really useful to know. And that they were also more open to trying new foods. So for us working with Cherwell Collective, the learning here was really simple but quite powerful. And that was when we allow solutions to fit around people's lives, participation follows. So recognising that the school holidays was a great opportunity meant that we got lots of participation and engagement. So here you go, just I had to split it over a couple of slides because there was so much to share. And just showing with the bar chart a little showing how the interventions really were impactful and drove some change as well. So what do the case studies tell us overall? I mean, not obviously Sustainable Wantage and Cherwell Collective are just two examples of groups that we worked with through this process. But across all of the groups that we worked with, we saw a really consistent picture emerging. People wanted less judgment and they wanted more practicality. People wanted affordable and achievable ideas. And people wanted support that worked for families and not just in individuals in isolation. This has really shifted our focus. So it shifted our focus from behaviour change to enabling environments. It shifted us from thinking about information to skills and confidence. And it's also shifted us from that sort of external delivery to community leadership. And I think that last one for me is really key learning through this. And I just expanded my diagram from the start where we had this lovely planning stage, but actually what we fitted into that still rung true and it was still worth doing. But then actually just recognizing how we had to impact through it how we had to adapt through it, sorry. And then the impact that we delivered maybe wasn't the impact that we're expecting when we started on this journey, but the impact that we got as a result of adapting through the process and really working deeply with a few groups is really quite reassuring as well. So as a food partnership who runs many of these types of projects on small and large scales, what has changed for us going forward? It has fundamentally shaped how we now work at Good Food Oxfordshire. So we look to really sort of design our projects with capacity in mind. So that's not just our capacity as a small organisation, but also the capacity of the people that we're working with. Really allow more time for relationship building, and also looking at really intentionally building skills into communities, not just delivering interventions. So that's that piece about the, not being very extractive, but thinking about how we can leave something more than just the memory of a cooking workshop, but the skills to be able to think about creating something useful themselves going forward and in the future. So lived experience now shapes not just what we do, but also how we do it. And that was a big learning for us at Good Food Oxfordshire through this process. So my key takeaways, if there are a few things I'd encourage others to take away from today, it's recognising that co-design really does take longer and you need to plan for that. Depth often beats breadth. I mean, you could argue that dependent on your project, but in this instance, that was certainly true. Academic rigour is incredibly important for research, so that we can stand behind the impact that we're making and we can show that we've collected that data in a way that stands up to scrutiny. But it has to be, when we're working with communities, balanced with that accessibility. And that sharing power, that whole living lab approach really does change the outcomes. But if communities don't benefit, then the engagement won't last. The lovely thing for me is looking at the groups that we worked with through this process last year. It was last year, mainly, over the last 2 years. You can see that those activities are continuing. So when we go out to our network and offer new grant opportunities or different projects that we're offering opportunities to join, those groups are really active still, and they've got great ideas and they know how to pull an initiative together. So for us, that just shows that sort of extra level of engagement, the extra time that we took, the skills that we built into the community group have been really beneficial for long-term change. And it is an iterative process. It's not something that you can change. Healthier and more sustainable diets don't change overnight. And I think that is all of my content. So I will hand back to you, Fabio.
Thank you so much, Caroline. I think this is a great avenue to have also honest conversations, not only about the many things that worked, but also the things that maybe did not work, so that one can reiterate and very much like you did and learn from the lived experiences on the ground. I think this is extremely valuable. So just one question from my side, then we'll pass on to the general Q&A. So once you started this reiteration process in your intervention, did you see, I mean, you touched on this a bit on your in your presentation, but the community getting more engaged when the effort required started lowering on their side, let's say?
Yeah, absolutely. I think that what we really recognised was all of our communities across the county are very different. They have very different needs, but ultimately they're the experts in what will work for them. And if it's something that they want and that they're enthusiastic about, then it comes naturally. So yes, the effort drops away because there naturally becomes more energy behind it.
Great. Thank you so much. Okay, well, thank you, Caroline. Thank you to all of our speakers very much for your contributions. We have some questions and answers. We have some time to go through them. Some questions were already answered in the question and answer section, but they might be relevant to share with all of our viewers. So we'll work our way from the top. Tim has a question for Anant in your presentation. So why, given the structural and normative relational power of industrial food companies, why did we feature them as macro level actors? Do we not see them more relevant as part of the regime rather than sitting at the niche level enabler at the meso level?
Yeah, thanks, Tim. Really important point. When we started the project, the focus was sort of on a multi-level governance perspective. And so we were looking more and focusing more on the policy side of things. And so we were thinking about micro, meso, macro from a policy perspective. And we included the kind of large multinationals in the meso, particularly because of their role in food environments. But since we prepared the proposal in 2021, actually, there's been a lot of stuff that's come out about corporate capture, regulatory capture that we weren't really aware of. And I've put a link in the Q&A to two reports that are fairly recent, one from a couple of years ago from Changing Markets, and then one from last year from the UN Rapporteur, which kind of effectively alludes to the outsized role that the large multinationals play and the lobby groups play in actually influencing policy. And so in that sense, they should not be at the macro level, ideally, from a policy perspective. But the reality is that they are. And this is, I think, something that we do talk about, but in terms of the diagram, we'll need to reconcile as maybe like something in red font or something like this. But yeah, I agree on this point that they are definitely kind of driving how the food system is shaped. Can others see those references that I put in, Fabio, or should I put it in the chat?
Yes, I think so.
Okay.
Anant is referencing some links he added as an answer to Tim's question. So if you go to the question and answer section, you can go to all the links he is referencing right now. I think this is also a good publicity to what actually FEAST has been doing since the start of the project. A lot of this has been discussed within the project and is being discussed, especially by the great team at Euro HealthNet, which is leading the policy work package. And on this topic, let me just say that there are some on the FEAST YouTube channel, there are some of our previous policy chats where this is touched on. So we also encourage you to go view those once you're done with this webinar. Okay, Tim also has a question for RAP. Are there any examples you can share of co-creating waste reduction infrastructures and community coordination systems that address waste at a household, street, and community level? This is from our side of trying to move away from just training towards supporting community know-how in relation to existing and new community assets. Rosemary or Louise?
Yeah, thank you, Fabio, and thanks for the question, Tim. I think it's really important. It points to a really important aspect of trying to change any of our behaviours around food is that yes, of course, RAP and many others on this call have a lot of evidence, we have a lot of insights, we can share knowledge, but actually behaviour change really is effective and happens when it's built and co-created, and it comes from the communities, the individuals, the groups themselves that can put those behaviour change programmes into action. So we always, our starting point is always through this, I put it in the chat, but through the kind of the test, sorry, my brain's gone blank for a second, test, learn and adapt approach. So, we trial things, we work with people, we develop pilots, we learn from those and then we adapt. But part of that test approach is always to work with communities and groups. So sometimes that's very much on the ground with with individuals, we bring people together. Sometimes it's with maybe our local government regions or local government structures, particularly at the moment in the UK, there's a big programme to roll out what the UK government are calling a simpler recycling programme. And one of the aspects of that simpler recycling is making sure there's a real standardisation around what is recycled and how it's recycled, so that at the consumer, at the household level, it doesn't matter where you live in the country, you know that, for example, you will have a food waste collection and you can start to learn about kind of what kind of waste can be put into that food waste. And one of the big pieces of work that RAP are doing currently, which I didn't mention in my answer in the chat, is to try and work with local authorities, not just to get those behaviours changed so people get used to using food waste collection, but actually through measuring, through seeing what they're throwing away. So seeing what you're throwing away, you get a much better idea of what food you're wasting, and then you can start to implement some of the behaviour changes and some of the changes to the way you live that will help you reduce how much you're throwing away. So it's very much a collaborative effort, and you know, that's how we see the biggest success in the work we do. And that obviously goes just as much for our kind of global or our international behaviour change campaigns, as Louise mentioned in her presentation earlier. You know, each of those different activations across the different countries that we work in are co-produced and co-developed based on the insights and the evidence that we have in those regions. So they're very much tailored to fit the local community areas. So I hope that helps. I put a couple more examples there that I could reference kind of online from some of two projects that we've done in the US as well recently that were co-produced with local community groups.
Thank you so much, Rosemary. And indeed, so I see from one of the messages in the question and answer section that they can't necessarily see the links that were shared. So we will add all the links that our speakers are referencing to the Feast resources page on the Feast website at Feast 2030, where you will also be able to find all the slides from today. Another question for RAP, and you kind of touched on this on your data-driven approaches, but from this question comes from Beth, and she says, well, first of all, this was a great presentation. She's a big fan of RAP and the Love Food Hate Waste campaign. She'd be really keen to hear what work you are doing with supermarkets, especially when it comes to reducing profit-motivated overstocking.
Yeah, I'll go for that one as well. It's a really great question, Beth. And I think from RAP's perspective, I did mention in my presentation our UK Food and Drink Pact. We have food and drink pacts across other regions across the globe as well, but I'll just talk to the UK one for a moment because it gives you a more concrete example. So, you know, we work really collaboratively with all of the major retailers in the UK. Again, it's a data-driven approach. So what we encourage retailers to do is to measure or set a target in the first place to reduce food waste, and then to measure and report on the waste that they're creating, and really focusing on that data is a real motivator. It encourages them to really look at the waste they're creating and understand what the systemic issues are behind that waste being generated. So you know, we're working with them to really tackle and address food waste at source. And if you're not familiar with the work we do around food waste, we very much follow what's called a food waste hierarchy. I've put a link again, we can share that, I'm sure, after the webinar to what this hierarchy is. But if you imagine it like an inverted triangle, and at the bottom is where that food waste might end up in landfill, for example, or going into incineration. And we want to effectively move waste up the triangle. And the very, very optimum thing that we're looking to achieve is preventing waste in the first place. So it's very much working with retailers, looking at reporting, measuring, motivating them to refine things like forecasting, looking at supply chain processes, and also collaborating with their suppliers to make sure that waste is prevented rather than created. So, of course, I think in some cases, and you know, although we're doing all this very, very detailed work, it's often inevitable that sometimes surplus will be created, and where it is within the hierarchy, as I mentioned, we're making sure that actually food reaches people as the very first choice. So there will be some food, some surplus that should be that is created and that should be therefore redistributed rather than thrown away. But we're very much working and focusing on that prevention, so it's not created in the first place. And I think the last thing to say is that, you know, we do work very closely and we do a lot of work with supermarkets, but retail waste in the UK is only 2% of the overall waste. So retailers themselves, yes, they have a big job to do in their own operations and to keep that focus on reducing and preventing waste. But we're also really reliant on working with retailers to actually influence their much wider supply chain. So all of their suppliers, right from the farm gate through to the store door, but also what happens when food leaves the retail environment as well. So when it's sold to you or I, retailers also have a role to play in helping their consumers buy what they need, store that food correctly, and then use what they buy.
Thank you very much, Rosemary, for that in-depth response. We have now one question from Maria from the University of Alcalá in Spain, who says she was very interested and very inspired in Caroline's presentation, because she says this is one of the first times she sees the presentations on how the challenges of a project and how they were addressed, going back to what we were saying before about having honest conversations about how to iterate. She asked specifically if there are any publications about this that can be used to cite, or any data that can be shared on this.
Well, thank you for that. I think maybe it's because I'm a cynical Brit, but I always think that we come on and share the good news stories. And I like the fact that we learn from failure. And not that this was a failure by any stretch of the imagination, but it definitely needed us to adapt. So thank you. Thank you for your comment. I really appreciate it. From a publication point of view, I'll look to Anand as I say this. I don't think that would come through in any sort of peer-reviewed publications, would it? But from a citation, could you not cite the webinar and the output from this? Anand, I don't know if you've got anything you could.
Yeah, we have our deliverable report with the case studies that will be coming soon. And that will be put on our Feast Zenodo, which is where we're going to have all of our outputs. I'll put a link in the chat to that so you can see what we already have up. So that should be coming imminently. The deliverable, it's quite a beast of a deliverable report. It's about 190 pages, which has the case studies from all of our living labs and some of the learnings. Some of the stuff that Caroline has mentioned, which is super important. We're working on publications to kind of capture the process using PICO, for example, this kind of scientific public health approach, the challenges and opportunities with actually using this type of methodology, etc. So we don't have it yet, but this is something that we're working on at the moment. And in terms of citation for the webinar, yeah, I think this will be on YouTube, so I think you could cite it. I don't know if there will be a transcript available, but it might be better to cite a transcript of something like this if this was something you wanted to cite. But I think the deliverable 4.3 is what it will be. I think might be your best bet. No, yeah.
Yeah, thank you, Anand. Thank you, Caroline. Indeed. So stay tuned. Again, Feast resources page on the feast2030.eu website, where you will find the deliverable Anand was mentioning, along with all our other resources, and the Feast guide for replicators, where we bring some insights on the Living Lab activities for those organizations that would like to replicate what has been done by our Living Labs. So stay tuned for any resources that will come up on that page, on our Zenodo, and eventual publications that we will share with our network soon enough. With that, this brings the first webinar in this new Feast series to a close. First of all, I would like to give a huge thank you to all of our speakers, so Anand, Rosemary, Louise, Alexandra, Kaya, and Caroline, for sharing your work, your insights, and the passion you've been putting into your work. Thank you, of course, to all of you who joined us today and contributed to the conversation and to asking questions and comments. Once again, if you would like to stay connected with the Feast project and follow our ongoing work and be made aware of future webinars in the series that will be coming out within this year and next year as well, we encourage you to follow us on social media and to follow the feast2030.eu website, where you will find the slides, the webinar recording, and all the resources, including the links that we mentioned today. Thank you so much, and we hope to see you at our next webinar. Goodbye. Have a good day.